Good day to you from Chem Help ASAP. In this video, we will emphasize the balance between the efficacy of a potential drug relative to its potential risks, as well as how this balance is quantified. By the end of this video, students will be able to connect efficacy to safety, describe tolerable risks relative to the therapeutic benefit, and visualize safety margin through dose-response curves. On the one hand, we have drugs being approved by regulatory agencies, and the drugs are approved as being safe and effective. On the other hand, we have Paracelsus, the father of toxicology, saying that only the dose makes the poison, which is to say that anything can be a poison at a high enough dose. Can approved drugs be both safe and effective and potential poisons? Yes, but we must acknowledge that the idea of a drug's efficacy, its therapeutic benefit, must be defined within the context of its potential toxicity, its safety risk. On the screen are adverse events observed for two different drugs. These adverse events were pulled from the prescribing information for each drug. Drug 1 lists fewer adverse events, but the rate of occurrence of those events is high, and the severity of the events is higher. I want to emphasize these bottom three. All refer to effects related to decreased cell levels in blood, whether lower levels of platelets, certain types of white blood cells, or red blood cells. In contrast, drug 2 lists more events, but with a lower level of incidence and severity. At first glance, you might look at these and think they can't possibly be safe drugs, but both have indeed been approved as safe and effective, and both remain as approved drugs today. What are these drugs? The drug on the left, drug 1, is Nilotinib. What is the therapeutic benefit of Nilotinib? Nilotinib treats certain forms of chronic myelogenous leukemia, so it is a cancer drug and carries potential life-saving or life-extending benefit. Once you know that drug 1 treats cancer, its safety risks are not reduced, but they might seem more acceptable. Drug 2 is omeprazole, which treats acid reflux disease. Treating acid reflux disease certainly increases one's quality of life, but acid reflux is not a fatal disease. Therefore, patients will only tolerate risks that are less severe and occur less frequently. These are just two drugs, but they do demonstrate that patients receiving a greater benefit from a drug will tolerate greater safety risks. Here are log dose response curves. The green curve is for the desired therapeutic benefit, and the red curve to the right is for toxic effects. During clinical trials, researchers will determine the minimum dose, ED, effective dose, required for a desired level of therapeutic benefit. The dose would likely encompass a dose range, but let's assume that this value here is the dose required for efficacy. At the therapeutic dose, there will be safety risks, as we see with the safety dose-response curve. Ideally, the acceptable risk of the drug will occur at a higher dose. Let's say here, the maximum tolerated dose. Based on these relative dosages, researchers can begin to define a safety margin for a drug based on the fold difference between the efficacious dose and an intolerable or unsafe dose. Keep in mind that some patients may not respond as well as other patients and may need a higher dose to achieve efficacy. Also, some patients may be more sensitive to the toxic effects and may experience a lower safe dose. Therefore, having a larger margin between the minimum efficacious dose and maximum tolerated dose is desirable to accommodate needs and responses from individual patients. We have now linked efficacy to safety. In that regard, we described tolerable risks relative to health benefits. We also used dose-response curves to visualize the idea of a safety margin for a drug. Thank you for watching all the way to the end. If you enjoyed the video, please consider leaving a like, subscribing to the channel, making a comment or question, or even watching another video. Take care.